morning, ladies and gentlemen. Thank you for the nice invitation and the nice introduction. Aquatic injury and illness prevention, the past and the future. Injury and illness surveillance is the first step to protect the health of the athlete. It is important information and the basis for the development of injury and illness prevention programs. It helps us monitoring long-term changes in the frequency, characteristic, and causes of injuries and illnesses, and to compare different groups. Last not least, it is important to increase awareness. The past. FINA started to take part in injury surveillance during the 2004 Olympic Games with water polo as part of an injury prevention program in team sports. At the next Olympic Games in Beijing, all sports were monitored and also all aquatic sports were included. In the following year, FINA introduced at its World Championship in Rome an injury and illness surveillance system. In the following years, injuries in water polo, marathon, and swimming were monitored during the Asian Beach Games, the Olympic Games, and the European Youth Olympic Festival. In 2013, FINA continued the injury and illness surveillance in Barcelona as well as in Kazan. And of course, it was included in the survey now routinely done during the Olympics. The FINA World Championship method, which is similar to what the Olympic does, is a simple form which we ask the team physician to fill in every day. And on the form, the team physicians report the injuries and illnesses of their athletes, and on the backside of the form, the codes and definitions are given. We have information from 3 FINA World Championships. The yellow bars are for 2009, the blue for 13, and the green for 15. And you can see the yellow bars in 2009, we reached only 40% of the return forms, but this increased in 2015 to more than 80%. So it's important that team physicians get familiar with the system because this has effects of the results. And I give you the results for all the 3 championships, but I would like to focus on the 2015 because we see an increase in injury, but this is due to the increase of the response rate, not that aquatic sports is getting more dangerous. So in 2015, we had 312 reported injuries. About a quarter of them were timeless injuries. This means that about 13 athletes in 100 were injured and 2.6 have a timeless injury. We have the same number of illnesses, but a fewer percentage of them resulted in time loss. Again, 13% of the athletes had an illness, but only 1.5 a timeless illness. I would like to have a slightly more detailed view on the injuries in Kazan to show you that there are huge differences between different aquatic sports. We had a high injury rate in high diving, diving and water polo, and a lower rate in swimming, synchronized swimming, and open water swimming. And you see the black part of the bar, which is timeless injuries. Also, timeless injuries were more frequent in high diving, diving, and water polo. But there were also differences between the aquatic sports whether or not they occur between training or competition. Synchronized and swimming injuries mainly occur during training. For diving and high diving, it was 50% for training and competition. And in water polo and open water swimming, about 75% of all injuries occurred during competition. This is also reflected in the injury mechanism, starting with traumatic injuries, which are rare in swimming and increase to water polo. So the orange part of the bars are the traumatic injuries, and you see in swimming it's only less than a quarter, but in water polo it's about 70%. And this information has important implication if you think about prevention. Location of injuries. Once again, we see differences between the 6 types of sports. With shoulder injuries, the gray part of the bar being most frequent in swimmers, as you all know. But, for example, synchronized swimmers had a lot of lower limb injuries, and so does the high divers. And we see a lot of upper extremity and head injuries in water polo. Last not least, severity of injuries. The good news is 3/4 of the injuries did not result in any time loss. Only 10 injuries had time loss of more than a week. This means only 1 in 200 athletes have a time loss injury which is moderate or severe. But again, we see differences. 5 of these injuries, so half of them, occurred in divers. So 5 injuries and 248 divers, which is a much higher percentage than in swimmers. Moderate or severe injuries affected shoulder, hand, but also lower leg and back, and about half of them were traumatic. And we had only 1 injury which was classified as severe with a time loss of more than 1 month in a diver who incurred during a competition a bone injury of the hand. Next, I would like to look at the illnesses during the Kazan Games. Again, we see differences in the illness rate between the sports. We have lots of illnesses in water polo swimmers and high divers, but again, the black part of the bar is the time loss illnesses, and these were more frequent in water polo players, swimmers, and open water swimmers. Again, the type of illness varied between the sports, but respiratory, which is the orange part, and gastrointestinal, the yellow part of the bar, are the most frequent illnesses in aquatic athletes. Severity, 83% of the illnesses did not result in any time loss, which means we have 1 to 2 illnesses per 100 athletes. And there was only 1 injury with 7 days time loss, ear pain in a swimmer, no moderate or severe illnesses during the Kazan Games. To summarize, the injury rate is lower in swimmers, open water swimmers and synchronized swimmers than in water polo players, divers and high divers. The injury rate in swimmers is lower than the average injury rate in Olympic Games. The injury rate of water polo players, synchronized swimmers and divers is about average of the Olympic Games. But we see differences in injury mechanism and diagnosis, which is important when thinking about developing prevention programs. Illnesses affected most frequently the respiratory or gastrointestinal system, and again we had differences between the disciplines, but they were inconclusive. There were only 3 studies on injuries during the season in the literature, and all were done in the United States, all on swimmers. 1 included divers as well, the study of care. You see that the injury rate per 1,000 athletics exposures were similar between men and women for swimmers, but different for divers. But you see also a difference between the numbers presented by Care and the 2 other authors. Despite of having only 3 prospective studies, we had 8 reviews on different topics of injury in athletic sports. Most of them were on swimmers, 1 on all aquatic athletes, 1 on synchronized sports, and 1 on water polo. So we can summarize the information which is at the moment available for swimming and say the injury rate is relatively low during championships. It's about 1.5 to 6.5 per 1,000 athletic exposures during the season. And to give you an idea, this is about the injury rate in training, not in competition, but in training for various sports in the United States college sports. Swimming injuries are mostly due to overuse and occur during training. And we have difficulties, especially in swimming, to distinguish between pain and injury. So because they are overuse injuries. And there are studies which report that more than 90% of the athletes report some type of complaints. Swimming injuries are mainly affected the shoulder, the back, and the knee, and we know that the risk factors is previous injuries as well as overload in training. We have some information on water polo, and here there is a relatively high risk of injury during championships. Most of the injuries are traumatic and occur during competition, and they affect the upper extremity and the head. There are concussions in water polo, and there is a specific publication by Blumenfeld 2016 who did a survey on members and former members and associates of the USA water polo team, and they reported that about 36% of the athletes had at least 1 concussion during their career. As usual, the injury rate was higher in female than in male athlete, but looking at the average rate of concussion, which was 2, the average was higher in men than in women. And there were differences between field positions in water polo, competition levels, and training and play. For other athletic sports, almost no information is available except the one I already presented from the FINA injury to surveillance during the championships. The conclusions of the review are the same as I can draw. Articles are consistently retrospective with few investigation on the spine, hip, and knee. And even more pronounced by Hill, just recently, the systematic review was limited by the quality of studies available. Poor study methodology or limited available data caused constraint to the estimation of risk in aquatic sports. So the conclusion is prospective cohort studies are needed with consistent measurements of risk for future studies. FINA did, to facilitate such studies, an international consensus which was published this year in the British Journal of Medicine, where all methodological standards for injury and illness surveillance are outlined and methods for a project supposed. The future. We need prospective epidemiological studies on the frequency, type, and severity, as well as on risk factors for injuries and illnesses in aquatic athletes. We need to develop sport-specific injury and illness prevention programs for aquatic sports. And then we need to evaluate the effects of the prevention programs in the different aquatic sports. And last not least, disseminate the information to athletes and coaches so that the prevention programs can be implemented widespread. And there are many methods for injury prevention, starting with warm-up and exercise-based programs, training and recovery, pre-participation screening, nutrition and hydration, lifestyle and hygiene, equipment, environment and pool conditions, rules refereeing and fair play, treatment and return to play, and information and awareness. All these measures have been proven to work, but they have to be implemented. Thank you very much for your attention.